on YouTube this weekend, we had a really great question from, well, first of all, a really nice letter from Rahab Amos. Thank you very much for the professionalism with which you do your work. You listen to your client, and you always put their needs first to ensure they live another day healthful and vibrant. Cheers to you, my doctor. Well, cheers to you, Rahab Amos. I really appreciate the kind words. Another person, I have a question, and this is the one I want to really go through, from Alex Angelo Abusiho. I have a question. What if a patient has an implant in his right humerus, that's the arm bone, and is it possible for him to undergo MRI of the lumbar spine? If not, is CT scan of the lumbar spine as effective in diagnosing lumbar disc herniation? And would CT scan of the lumbar spine be an equivalent as good a guide for interventional treatment of a lumbar disc herniation? Well, Alex, this is a great question. And so I understand that you have an implant in your humerus, your arm bone, and that it's made out of metal. And the first question is, if I have a metal implant in my arm, could I have an MRI of my low back? There's two things to unpack there. The first is, it depends on the metal. So non-ferromagnetic metals like titanium, not only are they more ductile, meaning you can bend them more times before they break, which make them good for medical implants, but one of the main reasons that they're utilized in orthopedic implants in places like the humerus, the arm bone, is that they are MRI compatible. They're MRI compatible. And then a question comes up not only with metals, like I broke a bone and I had a plate to stabilize it, but the question comes up all the time with implants, often pacemakers. I mean, the last thing you want to do is be in an MRI scanner and have the magnetic field of the MRI scanner mess with your pacemaker, right? I used to do even worse. I used to do brain implants for movement disorders. They're kind of like pacemakers, similar to pacemaker, but in the brain. And there was, the tip was made out of metal, and metal heats up in an MRI scanner. So the fear was, what if these things heat up inside the brain? Could they actually cause brain damage? And the answer is, it depends on what the implant or the implant is made out of. Those non-ferromagnetic metals like titanium are fine. And then a lot of other things are not fine. And even in the same device, you can find some are okay because they've actually been manufactured in a way which makes them safe for MRI. They're now pacemakers and spinal cord stimulators that are shielded. The electronics are shielded, and so they're entirely safe. And the metals that are used in them are not going to heat up in an MRI. They're safe. And then there's others that are not. Well, how do you know? Well, you just, first of all, the imaging center is a really, really good guide. In fact, they're really the experts on this. They have lists of all the devices, and if you tell them the serial number on your device or the exact type of device it is, you should have gotten a little card either from the manufacturer or at the time of surgery, which will tell you exactly what the device is. If you tell the imaging center, they're able to look it up. In fact, this is such a big issue that before you have an MRI, you complete a safety, they have a checklist, and one of the things on the checklist is to have you fill out a survey. Do you have any metal in your body? Ah, Alex showed up in the chat and says that his implant is stainless steel and not titanium. Thank you for popping in, Alex. Yeah, stainless steel is 100% not safe. It is 100, you can pick up stainless steel with a magnet on your own. And so the metal implant in your arm is absolutely not safe for MRI. So that answers that. For everybody else, if you don't know, the imaging center can help you figure it out. And the key is to know exactly what's inside of you. Now, Alex knows it's stainless steel, but let's say he didn't know. How could you find out? Well, all implants are carefully logged and those logs maintained at the hospital in which they're done. So you can ask your surgeon. It's surprisingly, the surgeon may have retired, died, God, who knows. So if you don't have access to the surgeon, If you have access to the surgeon can look in their operative report and tell you exactly what the implant was. But even if you don't, the hospital's probably still there, and you can go to the hospital and ask the medical records department for the implant log and a copy of exactly what was implanted inside of you. All right, so now in Alex's case, most importantly in particular, we know for a fact it's not safe. Stainless steel is going to cause a problem with the MRI. And it causes a problem kind of in two ways. One way is the thing I mentioned, it heats up. So it even heats up inside your body. The MRI creates images it's a giant magnet, a giant tubular magnet, and it creates a uniform magnetic field. So mostly water, but all the molecules in your body, they line up along that polar magnetic field. And then there's a pulse that pushes them out of that alignment. And the degree to which they move out of alignment and come back releases a little bit of energy. And that little bit of energy is actually what they pick up to make the image. It's not like a photographic image where the light comes in. It's the energy that comes in and is detected by the ring. And that's how MRI creates an image. So what's the problem with the magnet? What's the problem with the metal? Well, the metal distorts the magnetic field. So Alex's stainless steel in his arm creates a distortion when the giant magnet tries to line up all of the water molecules and then pulls them off. The ones around here are screwed up by the presence of the metal. And that creates a real problem. The image is distorted, and that distortion creates inaccuracy. So number one, it's not safe because it heats up inside your body and heats up a lot. It can heat up to very unsafe temperatures depending on the degree of the various combination of metals in the stainless steel. But then there again, even if it did work, it would screw them up because it's going to mess up the images and the radiologists can't depend on what they're seeing. So that's not safe. All right, so either because you're like Alex, you've got stainless steel, you can't take that inside the MRI, or you have a device that could malfunction inside the MRI, and so you can't have it. You cannot have an MRI, and yet you're fearful that you have a herniated disc. Well, Alex brings up a great option, and that is a CT scan. So a CT scan is totally different from an MRI in the way that it works. The CT scan is actually based on x-rays, just like you have an x-ray, a chest x-ray or a dental x-ray. A radioactive particle goes through your body, and the more dense the material, the more it's going to prevent that particle from going through. So bones are super dense, so they prevent more particles from going through. And then on the x-ray, you see the particles that came through but inverted. So bone is actually dark on x-ray, but we invert it so it's white. The whiter something is, the more dense that it is. Now, a CT scan is an x-ray like that, but it's done tomographically. The T in CT is tomographic. And what that means is it actually takes a series of x-rays. And the kind of CT scanner that you're having your scan is actually the number of particle beams that go through you. It used to be that they were 8, and then there were 16, and then there were for a long time they were 32. That means it's like having 32 x-rays, and then the computer reconstructs them all to get a three-dimensional image. Now it's 256. Do you think that's a lot of radiation? Yeah, it is. Well, it's 256 is a lot more than 16 or 32. So you can do the math yourself, but it's a lot. And so it is a lot of radiation, but it's really, really good for hard. It really shows bone. CT scan is really accurate in the abdomen. In the spine, it's really, really good for the bones of the spine and the joints of the spine. The disc, though, is made out of cartilage, and cartilage is low density. It's a soft tissue. And so the disc material is generally not easy to see on CT, and so CT is not as good as MRI at detecting a herniated disc, but it's still pretty darn good. And as a matter of fact, for many, many years, that's all we had. And it was actually sort of before my time. This was more the 80s and the early 90s, but MRI was not as available and CT was. And, doctors did the best they could and it worked out pretty well. So CT is the number 2, the backup. If people like Alex, you really cannot have an MRI, CT is the backup to decide whether or not you need, if you need imaging and it's not going to show up on x-ray, CT is better than nothing, that's for sure. Are there any other options? Yeah, well, there's one, and it's a combination of CT and myelography. Myelography is where they actually inject some dye in your spinal canal that can be seen on CT, and then it fills out the sleeves of the nerve root. This dye goes everywhere that the spinal fluid would go, and it shows if there's a disc there pushing, then you can see the channel that the nerve root should go through could be narrowed. Any volunteers? Probably not, right? You don't want to have an injection in your spinal canal if you don't have to, that's for sure. And who wants a dye put in their back? I would say CT scan is the way to go. And if I was very rarely when I was practicing as a spine surgeon, as a neurosurgeon in spine, if I really thought there was something there and the patient couldn't have an MRI, but they had a CT and it didn't show it, but I was just convinced there was something there and I really thought the person could potentially benefit from treatment, then I would send them for the CT myelogram. But it's very, very, very uncommon. And Alex, there's a really good chance if you need imaging that the CT is the way to go. So, and don't forget, the indications for having the CT of your spine for a herniated disc are exactly the same as having an MRI would be. And that is, you're in week 3 to 6, no red flags, you have mostly leg pain with associated numbness or weakness. I should say after 3 weeks. The first 3 weeks, most get better on their own, so we try to wait it out. The reason to have that CT is to document the herniated disc so that you can decide whether you're a good candidate for an epidural injection. And then if that doesn't work by week 12, you can think about having microdiscectomy surgery in order to speed up the healing, because we know that whether you have microdiscectomy or not, pardon me, everything's the same at 2 years, right? But if you just say, hey, I'm 6 weeks and I can't do another 2 weeks of this, or you have functional numbness or weakness, or the pain is just unbearable, then microdiscectomy is really something to consider. So I hope that helps. A lot of information, I know, but and maybe overkill in some ways, but definitely go with that CT, and good luck to you, Alex. Let us know how it turns out. And by the way, if you get the CT and you want to review it on the show, we can upload it to our secure and private server, and then I can go over it with you. You can either call in or I can go over it on the show so that you can see. And that applies to all of you. If you have imaging and you would like a second opinion, it's free. I'm not a practicing doctor anymore, but I know a thing or two about this stuff. And I'm certainly happy to go over it so that not only you can know what's going on with you, but other people can benefit from understanding where you are. And as a group, we can figure out how to take the next evidence-based step forward.